Good morning, Queensland, and happy Sunday. And we have some good news today. So if I'm smiling, I'm quite sure everyone else should be smiling as well. So we have 2 new cases. One is overseas acquired and detected in hotel quarantine, and one is locally acquired. So we'll have a little bit more to say about that in a moment. We have 46 active cases, more than 14,000 tests. We just still haven't got the update on the total number of tests, but that's still good news over that mark. And 7,828 vaccines delivered yesterday. So the one locally acquired case is linked to the Greek Community Centre, that Portuguese restaurant, so that's good news. And I just want to let Queenslanders know too that we've got one other case under investigation, but we'll be getting some further details about that, and if there's any concerns there, we'll let everyone know this afternoon if there's any exposure sites. But in terms of where we're at the moment, this is excellent news, and Dr Young will talk to you in a bit more detail, but you know, we're dealing with this alpha strain, it's not the delta strain, and it appears that everything is under control at this point in time, so we are very, very relieved about that. Can I thank Queenslanders for doing the right thing? I know that it's a big ask for people in those southeast LGAs and Townsville to continue wearing their mask and checking in, but we do need to all stick together for the next 12 days. And you know, we've still got a long way to go, but we're very happy and very comfortable where we are at the moment, and that's because Queenslanders are doing the right thing, and I don't want all that to unravel. So if we can please continue to wear our masks and check in, and of course it's absolutely critical that if you are sick, please go and get tested. So I just want to thank everyone. I know it's school holidays, I know it might have been a bit tough for parents out there with children over the last few days, but it's a beautiful day outside, and I'm quite sure that people are going to go out and enjoy the sunshine. Can I also just reiterate in relation to the over 70s, what we are saying is that if you are unvaccinated, please minimise your risk. You know, of course, you can see close family members, but we want you to minimise the risk during this time over the next 12 days. So thanks, Queensland, that's really good news, and I'll hand over to Dr Young to go into a little bit more detail, but we are very happy today to hear that news about only one community case and that it is linked. Thank you.
Thank you, Premier. Yes, excellent news. So first, thank you to everyone who's come out and got tested. Please continue doing that, particularly people in Brisbane, because we do have ongoing cases, not many, but we have ongoing cases from that Portuguese restaurant outbreak that has now spread to the Greek Community Centre. So it's really important. Any symptoms, come forward and get tested. So there were those 2 new cases overnight, one in hotel quarantine, a traveller who'd recently returned from overseas, and the second in home quarantine, went into home quarantine on the 2nd of July because they were a close contact of the Greek Community Centre. So they've now been admitted to hospital. Then there is another person of interest that I'm just doing further testing on, another close contact from the Greek Community Centre. So just working through there whether or not that's a case. But ultimately, this is good. These are alpha cases. We know they're linked directly to the outbreak that we've got going on. Then some good news from yesterday that is very reassuring. So if you remember, I mentioned the worker at the domestic terminal of Brisbane Airport who had tested positive on a surveillance test. They tested 700 people through those 2 airports, and one person who was well tested positive. We've gone and done repeat testing, multiple repeat testing on different platforms, and it's confirmed that that was a false positive, so that person was not a case, which is very good. So we still have those 2 Delta variant cases at the airport, but there's been so much testing since then. I'm relatively comfortable where that is. Then we've had the miners, and thank you to every single one of the miners. I know the resources industry has a really good process in place, and it was tested through that outbreak, but I'm confident that we've tested all of those miners and we don't have other cases. So that is good news. And they were Delta, of course. Then we had those airline staff on a number of Virgin flights, and we've tested all of those and we haven't found any other cases, and they were Delta. So it looks like those outbreaks that were concerning me are now relatively under control. We need people to keep on getting tested. We need people to remain in quarantine, who are in quarantine because they were contacts for any of those, but it looks like that is working through. Then we have this outbreak that is continuing. So it's really important that people in Brisbane in particular continue to get tested, and of course we had those cases go up to the Sunshine Coast, up to Umundi and to Aruna, the southern part of the Sunshine Coast. So anyone in those areas who've been to any of those exposure venues that are on our website, please make sure you get tested, and anyone in the Sunshine Coast area with any symptoms, get tested. So that's the Alpha variant. Then another piece of information that came through yesterday late is that we've got the genome sequence result for that worker who worked at the Prince Charles Hospital one day while infectious. They've got the Alpha variant, and it's confirmed that it is clustering with that outbreak from the Portuguese restaurant. So there's another case there that's been in the community that we just need to work through how that worker got it. But they do not have the Delta variant related to that receptionist who worked outside the COVID ward. They've got Alpha variant, and we've already got the full genome sequence back, and it's clustering with the Portuguese restaurant. So there's a lot of information there, but I just want to summarise it, that it is reassuring that it looks like we just have that one outbreak that we need to continue to closely manage. We've done this before. We've managed Alpha outbreaks very effectively before. We can continue to manage this one, but I do need people to continue to do some things for the next 12 days. I need people to wear their masks. This is a really important strategy. We didn't have it a year ago. We've got it now. We have plenty of masks. If there are people out there in the community, in particular groups and so forth, let us know and we'll assist and get more masks out there. But you can buy masks everywhere. They are not hard to find, so please make sure you are wearing them. And you need to wear them everywhere that you cannot socially distance. So indoors, you can't socially distance indoors. So unless you're like me here in this room, I don't have it on because I'm trying to speak clearly so people can understand me. But otherwise, if you're indoors, unless you're in your own home, wear a mask. If you're outdoors, unless you're strenuously exercising or you're genuinely by yourself walking in a walk in the park and so forth, wear a mask. If you're in your car with anyone other than your own family, wear a mask. So genuinely, think about when you don't have to wear a mask. So just automatically wear a mask and only take it off if you think, oh, that's one of those areas I don't have to. That's really important. Use the QR code. I'm so thrilled to see that our supermarkets have now got them in place. Make sure, if you can't find where you need to use that QR code, ask your supermarket where it is, so that they'll put it in a very prominent place. It's really important. Anywhere, everywhere, use the QR code, because then we can rapidly contact people. And of course, and I've left this one to last because it's the most important, any symptoms at all, just go and get tested. Don't think it's something else. Don't think it's your normal hay fever, sinusitis. Just please get tested and we'll be able to manage this outbreak due to the Alpha variant. Thank you. One other thing I do want to mention very quickly is vaccinations. So please, anyone due for their second dose of Pfizer, you must have it within 42 days of your first dose. That is critical. So if you aren't able to book an appointment, you can ring 134 COVID, or you can just walk into any clinic that's offering Pfizer vaccines. You don't need an appointment. So that's people due for their second dose, because you must have it within 42 days. That is critical. Preferably at 3 weeks, but you've got up to 42 days. And then the other thing I want to mention is we now have over 4,000 people in home quarantine, and home quarantine is not stay-at-home isolation. The only reason you can leave home quarantine is, of course, if you've got an emergency in your house, a fire or something like that. Of course you can. But other than that, the only reason you can leave your home is to go and get a COVID test. Now, if you are due for your vaccine, ring and get advice, and we'll help you sort that vaccine for you. Thank you very much.
So thank you, Queenslanders, for coming out and getting tested and vaccinated. I just want to emphasise what the Chief Health Officer just said. We now have 4,330 people who are required by law to home quarantine. We want to thank you, just as we did last year when we had tens of thousands of people who were required to quarantine in their own homes for 14 days, which we know is not easy. They can't go to work, they can't go to school, they can't go grocery shopping, they can't go out to get medicines. Our system's support is still there. So if you need assistance to get medicines, to get groceries, other type of support, our staff can assist, and we continue to send text messages and phone those people who are in quarantine. So I want to thank you, because those over 4,000 people are keeping us safe, and we are so grateful for what you're doing. But we're also here to support you, so please do not leave your home. You're not allowed to leave your home unless you're going to get tested. But if you need any support whatsoever, you can ring our 13 health line, but also you will be getting information through text and phone calls as we have previously. And of course there'll be random compliance checks, because we do need to make sure people are complying with their quarantine. And just as we have done for the last 18 months, we need to make sure that people are doing the right thing and keeping everyone safe. So there will be those random compliance checks, but I have no doubt everyone will be doing the right thing and staying home. Our check-in app becomes mandatory on the 9th of July, in 5 days' time. So businesses, if you have not registered and set up the check-in QR code, please do it today. Don't wait. Don't wait, because this helps us make sure that we can keep our community safe. Get that QR code up outside your business, and also make sure that someone is checking that people have actually checked in before they walk around your supermarket, your restaurant, your cafe, your business. I did notice yesterday that one Queensland check-in app QR code that was put up was in black and white. Can I encourage businesses to print out the colour? Why? Because your customers have come to know the maroon. We all look for that maroon QR code, and we know that's the Queensland app. So please, if you put that up in colour, it will catch people's attention, and they'll know that is the Queensland app and they need to check in. So we're strongly encouraging people to do that. But if we do this, we keep testing and we keep vaccinating. And as the Chief Health Officer said, if you are trying to book in for your second dose and haven't been able to, ring the COVID line, 134 COVID, or alternatively walk into any one of our community vaccination hubs, and you can find them on the website, which ones are open today and over the next few days. If you are due, we do not want you going past your 42 days, so please make sure you're getting your second dose. Thank you.
Good morning. So while yesterday saw the conclusion of our lockdown in particularly Brisbane and Moreton, unfortunately we did see some people decided to go early with that, and we were forced to take some enforcement action, which resulted in 17 penalty infringement notices being issued, 4 of which were for not wearing masks and 13 for non-compliance with the lockdown restrictions, including 4 males who decided to drive from Brisbane to Gladstone in the morning to attend the party. So whilst we hope we don't see any more lockdowns, the message for everyone is that they really need to understand what the requirements are of the restrictions are in place and abide by them, because we still have restrictions for the coming period. And that includes for masks. So we're up to 463 masks handed out to our community, including 11 yesterday. So we're still finding people not wearing masks when they should. Please remember to take your mask and wear it. We intercepted 2,085 vehicles at our borders and turned around 4. 1,832 domestic passengers arrived, and we put 59 of them into quarantine and refused entry to 4. We had 268 international arrivals yesterday, which brings our total quarantine, hotel quarantine numbers to 3,262 across 16 hotels. So still very full. We are managing at this stage, but obviously the message to all of those people coming across our borders, make sure that you have the right passes in play. And remember too that now in Queensland, when you're leaving Queensland to go to other places, you may well need a pass to get into other states. Thank you.
Any questions for me or Dr. Young?
So just on potentially getting a jab while you're shot, Woolies could stand up saying that it can help with the rollout. What are your sort of thoughts on this idea, and is it even possible to say?
I might defer to Dr. Young in relation to that to get some medical advice, but at the moment there are your GPs that are set up through the Commonwealth Network. You have our vaccination hubs that are set up through Queensland Health, so and then in some remote parts of our state, some of the pharmacies. So we'll probably see more pharmacies come online, and I think there are conversations too happening with industry about industry getting their particular workforce vaccinated as well. But I might just get Dr. Young to... Yep. Thanks.
What are your thoughts on this, Doctor? Is it safe? Is it possible?
The issue is more about supply. As soon as we get more supply, we can put vaccine out through more places. And I actually personally think every GP in our state should be vaccinating before we start looking beyond that, and every pharmacy. And then, yes, we can always look at more places to vaccinate, but there's no point when we don't have supply. We have got plenty of sites across our state to date to use all the vaccine that we've got. So as soon as we've got more supply, very happy to look at whether we need more places, but I suspect we won't. Our GPs and our pharmacies every year do an absolutely first-class job vaccinating people against flu. It is not a lot more for them to do this with COVID.
Dr. Young, with masks, how long do you see masks being part of our community and part of our day-to-day life?
For the next 12 days, they are absolutely essential, and then we will see what happens after that. What reassures me in Queensland is that every time I say now's the time to put on masks, people do it. So I don't think you need to be wearing masks when we don't have cases out there. So it's when we know that we've got the virus out in our community, that's when you need to wear a mask.
This latest case at the Prince Charles Hospital from yesterday, what position did she hold, and how far around the hospital did she travel?
That's what's being sorted through contact tracing at the moment, so that's all being worked through. But she had the alpha variant, so we will now have to go and work through. But she's in a hospital, so we know who she's come into contact with.
And she's definitely linked to that Portuguese
Yes,
cluster.
genome sequencing absolutely links.
Are any of them being treated at the Prince Charles Hospital?
Yes, but she hasn't been in the COVID ward. So we just need to work through all of those very, very sensible questions you're asking.
And are there any initial suggestions as to how that initial outbreak may have happened with the Delta variant?
The investigation is happening, but as you've heard, the investigators can't speak to the receptionist who acquired the case because she's unwell. She's a case.
Are you concerned with some issues with that hospital in particular, given...
No, I'm not. They've actually managed this extremely well. They just didn't consider this person who was outside the ward as being part of the COVID ward. That's the issue.
Dr. Young, how is it that businesses face increased restrictions for the next 12 days that the people can go ahead this afternoon with the most outcomes?
Because remember that we've got all of those COVID-safe plans. So all of our businesses, all of our stadiums, all of our indoor venues have plans that they have got in place. And the stadiums have actually done one of the best responses since the start. So once they really got into this, they worked it out. So they not only have tickets and know where all these people have come from, but they've made absolutely sure that everyone uses the QR code going in. And we saw that at the State of Origin. There were more QR codes than there were people because they had to QR code within the facility as well. So I'm very, very comfortable. Plus, we've not seen outbreaks at any of our stadiums. If you think about it, we've had positive cases across Australia attend in stadiums, and they've not then seen outbreaks. Because people, when they go to a stadium, and I know they do this, they go and sit in their seat, and they don't then go and move with the other people all around the stadium. They stay in their area, and when they need to get up, wear a mask, they go buy their food or their drink, go back to their seat. They go to the bathroom facilities, go back to their seat, which is totally different to our indoor areas, our hospitality and so forth. So I am comfortable as long as people wear their masks going until they sit in their seat and they've got compliance there in that stadium. They absolutely make sure. Then they check in with the QR code. That's really critical. And people who are sick don't attend, and people from hotspots don't attend. So I know all the work the stadium's done to go through all of the tickets to see where people have purchased tickets from. So I am as comfortable as I can be that they are no riskier, in fact, I think, safer than a lot of our indoor venues.
Sophie, are you surprised that we haven't seen more cases?
Surprised is different. I'm pleased. And I'm pleased that people are following all of the advice and doing such a good job, and I'm pleased that people are coming forward and getting tested. You deal with the results you get. So it is really good to see that all of those Delta variants that I was very concerned about, all of those look like at this stage they've been managed, and we've had so much testing. I would have thought I would have found cases, because the Delta variant tends to transmit very quickly, and we've not seen that. So the message really is, please, if you're sick, just get tested. It's so important, because then we can find those cases.
Sophie, just on checking in, apparently there are some markets this morning that don't have a QR code. Are they required to have a QR code at markets?
Right, remembering they're outdoors and they've got to separate out, so they're a bit different in terms of their risk.
Dr. Young, just with exposure sites for this new case, are there any that we should be
We're
worried
getting all of those as we speak. But she went into, so she was identified as a close contact on the 2nd of July when I announced the 2 people who live in Carindale, and she went into quarantine then. So we just have to work out how long she was out in the community before she went into quarantine on that 2nd.
There's also been cases at the airports. Do you think the Commonwealth should be mandating vaccines for the airport workers, making that a mandatory requirement?
Well, here in Queensland, I've certainly made it absolutely available, and we're vaccinating all of those people who work at the airports.
Here's a question for the Premier. You were warning the other day, or the government was warning the other day, that we're going to run out of vaccines. Where are we up to with that? Are we at risk of running out of those?
Look, I'm getting a briefing tomorrow. We do know that we've got enough for second doses, but we do need more supply, and we'll get an update from the coordinator, and I'll be able to update you further tomorrow morning.
There's no sites, you don't think, at this stage?
Sorry?
There's no sites that are going to run out at this stage?
No, not today.
And what about, in terms of small business, the opposition's been calling for a dedicated support package for small businesses who are impacted by lockdowns. Do you think the government could be doing more on that front?
We've given a lot of support to businesses throughout the pandemic. We had our, over $10 billion economic recovery, the $180 million small business adaptation grants as well to help and assist. We helped the tourism industry that time with their local campaigns, and I'm quite sure that we can do some small assistance in terms of getting people out to support those businesses once we get through this challenging period.
How long does the lockdown have to last before, I guess, the government considers?
I think my understanding is, from memory, from the federal government, it's over 7 days.
So that's how long
I'll double check that
is
for
that
you,
how
Jack.
long it would take for the state to act about 7 days before
I'll double check with you on that, okay?
Premier,
Yeah.
on lockdowns, Scott Morrison said lockdowns should now be a last resort after National Cabinet. Does that mean this could have been our last lockdown?
Last option once everyone's had the opportunity to get the vaccine. So we're not at that stage yet. We need the supply and we need that opportunity for every Australian to be offered the vaccine. And once we get to that threshold, then of course I think you'll see very minimal need for it. But we're a long way from that. A lot of modelling needs to happen as well. AHPPC is doing that work, I think, with one of the institutes. So they'll be getting that information and providing that to National Cabinet.
And as far as the game today, can you understand confusion in the community when on one hand, okay, first of all, why are we protecting the most vulnerable? We're protecting the most vulnerable in our community because if they get COVID, their risk of hospitalisation and getting severe illness is very high. Secondly, we've asked people to wear masks. We didn't have that ages ago, remember, because we didn't have the supply of masks, but the world now has a large supply of masks. And in relation to today's event, my understanding is they've sold about 14,000 tickets. It's about a quarter of capacity today. But as Dr. Young has said, we have got these COVID-safe plans in place for venues right across our state. Okay, thanks everyone. Have a happy Sunday, everyone. Happy Sunday.